Welcome back to the wellness segment of Fresh, and we are here in the dental offices of Dr. Norm Bryan and Dr. Anjana Gupta, and we are here to talk dental medicine once again, and we'll talk to Dr. Gupta here in just a second, but wanted to turn here to Dr. Norm Bryan and just kind of catch up a little bit. It's been a good summer, I take it, right?
Well, it's been a little cool, but the last few days have been wonderful, so I've got a little sailing in and refreshed a little bit and ready to go for the fall.
Good. That's important to have that kind of time to do the things you love. But with that, also, you took a little time to get updated on some of the cutting-edge technologies in your profession. And it's really interesting because not only do you personally learn, but you're able to apply that almost immediately, aren't you, to the patients that you serve?
Absolutely. We attended a symposium in San Antonio for 4 days. It was a TMJ, sleep apnea, sleep medicine symposium. So we learned a lot. We brought a lot home, and we hope to utilize that immediately. And we have utilized it, many of the aspects immediately, as Anjana will go over with you. And we're excited about some of the new techniques available and some of the new things we can do to help people that have these problems.
All right, as we've learned in previous shows, what goes on here in the office goes well beyond dental medicine and really into the more general area of wellness, total wellness for the individuals that are helped. Doctor, thank you, and we'll catch up with you on the next show and go in more detail with you. Right now we want to talk to Dr. Gupta about the technology, and we're going to look at some of that up close and personal today, aren't we?
We are. Today I'm going to go over our new at-home sleep appliance, which is something that we learned about at our symposium this summer. And so we're going to actually sit down today and show you how that works, what it does, and what it does is it diagnoses sleep apnea. So we're going to go over that today and show you how you can do that at home.
All right, let's get right to it, huh?
Sounds good.
Well, we are back here in treatment room number 4 with Dr. Anjana Gupta. And Dr. Gupta, let's get right to this exciting new technology that you want to share with those at home and your patients. Tell us what we can expect.
Well, as you know here, Craig, at our office we treat TMJ, temporomandibular joint disorder, and sleep disorders with dental sleep medicine. And so one new technology that we have here in our office is a at-home sleep study, which is made for diagnosing sleep apnea or help in diagnosing sleep apnea with your family physician.
What I like about what you've said already is it's at home, and how comfortable must that be for the patient rather than going to some sleep center, with all due respect?
Right. You're exactly right, Craig. Most of the time, the reason that diagnosing sleep disorders get put off by the general physician is most likely because the patient doesn't want to go have a sleep study done in a hospital. No one wants to spend the night in the hospital if they don't have to. And so this is one way that we can do the study, get the diagnosis, and the patient can be treated for the sleep disorder, which is really the ultimate goal.
Gotcha.
So what we have here is the Metabite system, and you can see here this is basically the computer portion of the unit, and you can see here it's about the size of an iPod, and it fits over your chest like so, and so this is the computer portion of it. And then it has 2 straps, one that wraps around the chest and one that wraps around the abdomen. And then from there you have the pulse oximeter, which measures your pulse. And then you have a nasal cannula that helps measure the pressure. It also measures snoring. There's a microphone that comes and tapes to your forehead.
Cool.
It actually records your snoring.
Can I use that on these TV segments maybe, huh?
Sure you can. And it most importantly records the apneic episodes and the hypopneic episodes, which are actually where the patient stops breathing or has shallow breathing. And so then from there, the machine uses those parameters to come up with a diagnosis or a apnea-hypopnea index, which is your apneic episodes and your hypopneic episodes divided by the number of hours that you're actually sleeping. So what that does is we provide you with this kit. You take it home. We show you how to hook it up. As you'll see here in a few minutes, it's really simple to hook up. You bring it back the next day. We download the information into our computer, which you can see here. It gives us this histogram, and it gives us all of our readings. And And from there, it gives us a printout. And you can see here, this is a copy or a sample of the printout that gets sent to the physician. So this gives you all the parameters that the physician is going to need to make the diagnosis. So we fax this to the physician, they read it, they give us back their diagnosis, and therefore we have a diagnosis and we're able to treat the sleep apnea.
All you need now is some likely candidate to kind of demonstrate how this equipment works, huh?
Sure, and that's what you're here for, Craig.
All right, well, as you can see, we found someone to help out with the demonstration, and you guessed it, it's me. And Dr. Gupta, tell us a little bit about what you've got on me here. There's a lot of different functions that are going on.
Well, first of all, Craig, I appreciate you being our example here.
You were going to say guinea pig, weren't you?
No, of course not. As you can see here, Craig's all hooked up to the at-home sleep study. I'm just going to point out the few parameters here. First, we've got the snoring microphone. This small red piece here is a small microphone that will record your snoring while you're sleeping.
Broadcasters love these, by the way, snoring microphones. Every broadcaster loves them.
And then here we've got your nasal cannula. So we can unhook you from that.
Wow, that feels better already.
And then here you've got your computer, and then hooked up to the computer, this is the nasal pressure cannula. This is the pulse oximeter that connects to your finger. This is where the microphone hooks in. And then coming out of the computer, there are your two straps, your your chest strap and your abdomen strap. And then those get hooked in to the bottom of the computer based on, you know, this is your abdomen sensor and this is your chest sensor. So all you have to do to unhook yourself is then unhook these clasps right here.
Well, easy enough. And so someone coming to your office, getting a little bit of an update, could go home and do this himself or herself.
Sure. We show you how to do it. We show you how to put it on, how to take it off. We have you do it in front of us. So really, as you can see, it's fairly invasive when you're sleeping. You know, I mean, there's few straps, few cords, so it's pretty easy to wear at night when you're sleeping.
All right. So after you gathered the information, it goes into a computer, and then a printout then takes place, right? That the doctor can review.
That's right. We download the information from here, and then on our computer, this is what we get here. We get our printout, which gives us our apnea-hypopnea index. It actually will give us their diagnosis. It has all your information in it, including your weight, height, neck circumference, weight-height ratio, all the information that we would need to get an accurate reading. So then this is the information that gets sent to the physician or pulmonologist who reads the study and therefore makes the diagnosis. So once you have a diagnosis, you're able to treat the disorder properly. If it's mild to moderate sleep apnea, one of the best ways to treat that disorder, and it's recently been stated by the American Academy of Sleep Medicine that dental appliances are the standard of care for treating mild to moderate sleep apnea. Wow. So
you probably see a lot of people in that category, don't you?
We do. We see a lot of people. Some statistics are saying that 60% of people over the age of 60 have sleeping disorders. Wow. So, you know, that's where we come into play. If the diagnosis says that it can be treated with a dental appliance, the SomnoMed, which we've shown on previous episodes that Dr. Bryan's going to talk about later, is a great route to go.
Well, Dr. Gupta, thank you so much for, again, providing some wonderful information, a new technology here available at your offices. And really, we're not talking about thousands of dollars here for this kind of treatment.
Right. That's one huge difference between the at-home sleep study and a night stay in a hospital. You know, a night stay in a hospital, as we all know, can cost thousands of dollars. A sleep study like this is going to run a patient around $300 to $400. And so you're really looking at a fraction of the cost, which is always an important factor.
Yeah, absolutely. Very good. Well, thank you again.
Thank you, Craig.
We'll be right back right after this. Stay tuned.